Certainly, it's not going to be perfect. And of course, there's going to be some bumps on the road. I still think that regional reopening plan is a rather reasonable approach. Toronto, Peel, and Windsor, Essex have more cases than other places. They're probably not yet ready to reopen. It's a cautious approach. Of course, there's going to be some people that are going to say, oh, you know what, I live in Toronto. I'm just going to drive to a neighboring place to go to a pub or get my haircut. That's always going to happen. But I think for the bulk of people that live in these regions, it's likely going to be a workable solution. And having said that, even these three regions are still doing well. They're still getting better and better. The data is still improving. So perhaps those three regions will be reopening in the coming week or two as the numbers continue to improve there.
Because of that, Markham, Ontario is a community in the region of York, so that's one of those allowed to open on Friday, and it's moving to phase 2. The mayor of Markham, we're going to pull up a statement, is renewing calls for the citizens to take safety measures, but also he's asking the province to make wearing masks mandatory in any enclosed spaces, Dr. Bogoch, where physical distancing is impossible. There is the statement from Mayor Scarpiti. Now, I'm wondering, we've talked about masks often. We're also hearing from Alberta doctors asking the province the same thing. Make masks mandatory in any enclosed spaces where physical distancing is impossible. There's a lot more research coming in on that issue as well. A couple of modeling studies out of the UK just this morning. What are you hearing in your circles now? Is the wisdom of mandatory masks, is it shifting at all, or is there further discussion of it?
Well, it's interesting because there's probably several different conversations going on, and some of them are very vigorous pro-masking conversations. Others of them are less so, and others take more of a middle ground approach. I think no one would argue that wearing a mask in an enclosed setting, in an indoor environment where you can't practice physical distancing, is a good idea. There's no one's really arguing about that. The key thing here is whenever you make something mandatory, you have to be very mindful about what the outcomes may be. How is that going to be enforced? Also, is this going to be overly restrictive? This is an equity issue as well. You cannot mandate masks and then not provide them free of charge. For example, you can't not allow someone to come into a business or go on public transportation because you mandate a mask. Many people might not have the means to buy a mask or may not have the means to make one, and you cannot limit access to businesses or public transportation or anywhere because people might not have access to them. So if you're going to mandate them, you've got to give them out for free. These are public transportation is for everybody. You just can't exclude people from living and interacting with the world around them simply because they don't have a mask on. We have to give everyone the opportunity for success here.
We have certainly heard announcements to that end from Alberta, Quebec, a number of other Canadian provinces. We'll wait to see if there's any further guidance on that from Ontario in these days to come. Can we spend a moment or two on the global picture, Dr. Bogoch? We're looking at numbers globally of more than 8 million now. And it took only 1 week for the number of cases to jump from 7 to 8 million. So it jumped more than 1 million in just the span of a week globally. And the rate of spread is getting faster and faster. What concerns do you have about the international situation and the potential impacts here?
Well, it's phenomenal and obviously very sad to watch. Certainly, there's such a disconnect. When we look at how we're doing in Canada, we see this infection under terrific control across the country, even in the hardest impacted areas of the GTA and Montreal. Even those places are now getting this infection under control. But the second we look outside of our borders, we see that it's disastrous in many parts of the world. South America is just taking off. South Asia is taking off. Even the southern United States is showing an incredible rise in the number of new cases. So this pandemic is far from over. And really what this boils down to me is we've got to be very, very careful about our border. We've got to be very stringent on who we allow or the policies that we have for incoming travelers to Canada. I don't think we're going to see our Quarantine Act go away anytime soon. And rightfully so. This has the potential to undo all the hard work that we've done here in Canada to get the epidemic under control here. But certainly, this is still getting worse in many parts of the world. And we're, if we really look at the 30,000-foot view here, we're in desperate need of a vaccine. We really need a durable solution out of the mess that we're in, because this is going to be going on for a long, long time if we don't have those solutions in place.
It is still among us, and you're right, the vaccine push continues apace. But when you mention exactly what you've done, it's probably worth pointing out New Zealand. Just last week, we were talking about how it had declared itself virus-free. This small country, island nation, had control of things. Well, just this morning, reporting it has 2 cases, travel-related, 2 members of a family, young women coming in from the UK to Australia and into New Zealand, getting out of quarantine a little bit early for personal reasons, compassionate reasons, and now 2 cases back in New Zealand. So it just speaks to the travel, it speaks to border, it speaks to the whole challenge, I guess, of reopening and caution there, Dr. Bogoch.
Yeah, absolutely. Absolutely. And it's just a reminder that you can do everything right. You can have the right measures, the right policy, the implementation of that policy, and you can still see cases. So there really is nowhere on earth that's going to be safe from this infection until we have a durable solution. And this is the type of infection where if there's a problem in one part of the world, there's a problem on the whole planet. And we know that people are mobile, even with the travel restrictions in place. And there certainly is the potential for spread and reintroduction of this virus to places that have had this infection under control. Beijing, for example, is another great example. There's a big outbreak in Beijing, whereas China has largely controlled the spread of this infection. And now we hear that there's probably greater than 100 cases likely related to a crammed market in downtown Beijing. So it's a reminder that this is not going away anytime soon, and we still really need to be adherent to our policies to keep us safe.